Hey y'all, what's going on? This is Jackie Marie, and today I'm making a video about monkeypox. The screen is black with the letters because I did not want to put a picture up of monkeypox. It is disgusting. But we're gonna talk about it. It's I'm not gonna say it's on the level of COVID, but yeah, it is there. Um, So basically, monkeypox is a disease and it's been around for a long time. It was mainly over in other places like Africa, places like that. But for whatever reason, it is spreading now, and it is now in America. It was in some European countries. I think that's where it started. I want to say I heard it started in Spain, and now it is in America. And as of August 18th, 19th, they had about 40,000 cases. I'm sorry, let me rephrase that. 14,000 cases in the United States, and they had about 40,000 cases globally as of August 19th. So about 10 days ago. And the number one state in America with it is New York. California is second. Last I heard, Florida was third. And it has reached all 50 states. So somebody in every state got monkeypox. And they said that it spread through sexual contact, and it's mainly spread through men who have sex with men. And but there have been cases, reported cases of women getting it, or it being spread not sexually, and that's what concerns me. So I was reading an article, and it was talking about how the virus may, well, I don't want to say live. It was just saying that it was detected on objects. So in Utah, the Utah Health Department, they swabbed objects in the home where two infected people had been isolating for 20 days. And the patients were still showing symptoms when the samples were collected. And the samples included, cloth furniture, blankets, handles like door handles, light switches, things like that. And the monkeypox material, like the genetic material, was detected, even though they said that it didn't have the live virus. So, like, if you touched it, so like, let's say I went over to their house and I touched the light switch, the monkeypox material was there, but it wasn't alive. The virus wasn't alive. So, more than likely, I wouldn't get monkeypox, okay? But then, we also got to look at, children being infected with it. Now, they're not giving too many details on how the children are being infected. They're just like in the same household. Some of them aren't in the same household. I think I want to say in California, it was a little girl who got it, but no one I think it was a 2-year old, but no one in the household had monkeypox. So they were trying to figure out how she got it, because I don't think she went to daycare either. So they were trying to figure out how she got it. And then, of course, there are children who were in the household with people who had monkeypox who got it. So we don't know if it was, sexually, or if just by touching something. And then, of course, we had the dog. We had, I want to say, 2 dogs over in Europe that got the monkeypox on the bottom. It kind of makes sense because they said the dog shared the bed with the couple, and we know dogs like laying. People had their dogs in the bed with them, and the dog had it on the bottom. So if the dog is sitting, on the sheet, and then the dog also had monkeypox on the tongue, and we know dogs do lick themselves. So I mean, that makes sense. That makes sense. My thing is, if this is they're saying this is being transmitted sexually, and from what I'm hearing, yeah, because people are getting people are having a hard time breathing if they get it in their throat. They can't swallow. It hurt. Same thing if they get it uh, annually, annually. Cause if you've seen the pictures of people who have it on their face, that shit is gross. Okay, and so just imagine that inside your anus. And I heard they got to take stool softeners to have a bowel movement, like, and they still screaming. Okay, cause I was like, Lord Jesus, ooh, just the thought of that, I was like, y'all ain't had to tell me that. Okay, cause now I'm like, wow. So it ain't no good time. Okay, yeah, I wouldn't wish that on my enemy. But you know, oh, and there was a reported case of an employee. I want to say in Philadelphia, it was somewhere in Pennsylvania, who they worked at a hospital and they had got monkeypox, and so they were talking to people who had came in contact with them. And this, I don't want to say it was a nurse. I want to say it was a nurse. It could have been, just personnel, but there was an employee at a hospital in Pennsylvania who got it. But yeah, my thing is, if it is, on surfaces, that's a whole different thing. Um, but I don't know. I'm just sitting back watching and seeing what's going on. And yeah, it just, this is something, because ain't nobody trying to have no monkeypox. Ain't nobody trying to have that. I wouldn't wish that on my enemy. Okay, just the thought of it, I wouldn't wish it. But yeah, because like in Atlanta, the girl who got it, the black girl who got it, I don't know if you saw it on TikTok. She said that she worked at a gas station, and she thinks she got it from handling money, and she had bumps on her face and everything. And then she had a few bumps on her hands, well, like on her hand and maybe upper arm, which is kind of weird. But she said she didn't get it sexually. She got it from handling money. And then it was another guy who stated he got it from a toilet seat. I didn't even know we sit on toilets in public, but that's just me. I don't know. I don't sit on public toilets, but he said he got it that way. So I don't know. I I don't know. So I mean, I think the primary way may be sexually, but it could be, it could be transmitted, by touch, and that's even scarier. And that is why we got gloves. Okay, that's why we got gloves in the house. I was like, Mama, what size glove you wear? Because my mom's a nurse. She's like, so okay, we got gloves, because it was just like with the pandemic. I was paying attention. I was like, why is China building all these hospitals? Something is going on over there. Something don't happen. And I started ordering stuff. I ordered gloves and I ordered wipes, because I'm like, something is going on over in China, like right before the pandemic started. And I don't know, I got the same feeling about this. I mean, I'm not sitting here, petrified of monkeypox, but I don't want nobody in this house to get it. So, but yeah, let me know if because let's see, I know let me know if you work in a hospital. Put it in the comments below if you worked in a hospital that has had a monkeypox patient, and what was it like, or you heard that there was someone, like, and you ain't got to tell, don't tell all the business, but just say, yeah, I worked at a hospital, we had a monkeypox patient, and and if anything you might have heard, But other than that, that's all I got for you. You can follow me on my blog. It's J. Marie Booklist. That's where I talk about being a unit secretary. And I'll talk to you later. Bye.